Hello and welcome to our comprehensive Pigeon Health channel. I'm your host, and today we're diving deep into one of the most critical health issues that every pigeon keeper will face: respiratory infections. This is going to be an extensive, detailed guide that will give you everything you need to know about recognizing, preventing, and treating respiratory infections using proven natural methods. If you're new to our channel, don't forget to hit that subscribe button and ring the notification bell because we regularly share in-depth, science-based information about protecting your pigeon's health using natural methods. Today's video is going to be comprehensive. We're talking about a 25-30-minute deep dive that will make you an expert on pigeon respiratory health by the end. Before we start, let me tell you what we're going to cover in today's extensive session. First, we'll understand exactly what respiratory infections are and why they're so common in pigeons. Then we'll go through a detailed examination of the 4 distinct stages of respiratory infections, learning to recognize even the earliest symptoms. After that, we'll explore comprehensive prevention strategies using natural herbs and environmental management. Then comes the main section, detailed treatment protocols for each stage using specific herbal combinations. We'll also cover case studies, emergency situations, and long-term management strategies. Let's start by understanding the fundamental nature of respiratory infections in pigeons. The pigeon respiratory system is remarkably efficient, but also uniquely vulnerable. Pigeons have air sacs throughout their bodies that allow for continuous airflow, which means they can extract oxygen extremely efficiently. However, this same system means that respiratory infections can spread quickly throughout their entire respiratory network. Respiratory infections in pigeons are caused by bacteria, viruses, fungi, or combinations of these pathogens. The most common bacterial causes include Mycoplasma, chlamydia, and various streptococcus and staphylococcus species. Viral infections often involve paramyxovirus, herpes virus, and adenovirus. Fungal infections, while less common, can be particularly serious and usually involve Aspergillus species. What makes pigeon respiratory infections particularly challenging is that they often start as mild upper respiratory issues, but can quickly progress to severe systemic infections if not addressed promptly. The interconnected nature of the pigeon respiratory system means that an infection starting in the sinuses can rapidly spread to the lungs, air sacs, and even affect other body systems. Environmental factors play a huge role in respiratory infection susceptibility. Poor ventilation is the #1 risk factor. Stagnant air allows pathogens to build up and makes it easier for infections to spread between birds. Overcrowding multiplies this risk exponentially. Temperature fluctuations stress the immune system and make pigeons more susceptible. High humidity can promote fungal growth, while very low humidity can dry out mucous membranes and reduce their protective function. Stress is another major factor that predisposes pigeons to respiratory infection. Breeding stress, racing stress, transportation stress, and environmental changes all suppress the immune system. When pigeons are stressed, their natural defenses are compromised, making them easy targets for respiratory pathogens. Now let's examine the 4 distinct stages of respiratory infections in detail, because understanding these stages is crucial for effective treatment. Stage 1 is the initial infection stage, and this is where early intervention can prevent serious illness. At this stage, the infection is typically limited to the upper respiratory tract, the nostrils, sinuses, and upper throat area. The symptoms are very subtle and can easily be missed if you're not observing your pigeons carefully every day. The earliest sign is usually a very slight nasal discharge. This might be clear initially and present in very small amounts. You might notice just a tiny drop at the nostril opening or slight moisture around the nostrils that wasn't there before. This discharge might only be visible in the morning or after the pigeon has been resting. You might also notice occasional sneezing or head shaking. This isn't the violent head shaking associated with ear problems, but rather gentle, occasional shakes as if the pigeon is trying to clear something from its nose or throat. Some birds might rub their heads against perches or cage bars more frequently than usual. Eye changes at stage 1 are very minimal but observable. The eyes might appear slightly less bright than normal, or you might notice very mild watering. Not obvious discharge, but just a slightly moist appearance around the eyes that's different from normal. Behavioral changes at stage 1 are subtle but important. The pigeon might be slightly less active than usual, though still eating and drinking normally. They might spend a bit more time resting, or their normal vocalizations might be slightly reduced. These changes are often so minor that they're attributed to weather, slight stress, or normal variation, which is why many stage 1 infections go unnoticed. Stage 2 represents progression to moderate infection, where the symptoms become more obvious and intervention becomes urgent. At this stage, the infection has usually spread deeper into the respiratory system and may involve the lower respiratory tract. Nasal discharge becomes more noticeable and often changes character. Instead of clear, watery discharge, you'll see thicker, cloudier discharge that might be white, yellow, or even slightly greenish. The quantity increases and you'll notice discharge present throughout the day, not just occasionally. Eye involvement becomes more obvious in stage 2. Both eyes might show discharge, which can range from watery to thick and mucus-like. The area around the eyes might appear slightly swollen, and the conjunctiva, the pink membrane inside the eyelids, might appear redder than normal. Breathing changes become noticeable at stage 2. You might hear slight sounds during breathing, particularly when the pigeon is resting or sleeping. These might be soft clicking sounds, gentle wheezing, or slight whistling sounds. The pigeon might also begin breathing through its mouth occasionally, particularly after mild exertion. Behavioral changes become more obvious. The pigeon's activity level decreases noticeably, though they're still mobile and alert. Appetite might decrease slightly, and they might show less interest in normal activities like preening, bathing, or social interaction with other birds. Stage 3 represents severe infection, requiring immediate and aggressive intervention. At this stage, the infection has typically spread throughout the respiratory system and may be affecting other body systems as well. Respiratory distress becomes obvious in stage 3. The pigeon will breathe with its mouth open frequently, and you'll hear obvious sounds with each breath, wheezing, clicking, or rattling sounds. The bird might stretch its neck forward and pump its tail with each breath, indicating respiratory difficulty. Nasal and eye discharge becomes heavy and obviously infected. The discharge is typically thick, colored, and may have an unpleasant odor. The eyes might be partially or completely closed due to swelling and discharge, and the area around the nostrils might be crusted with dried discharge. General condition deteriorates significantly. The pigeon becomes much less active and may spend most of its time sitting quietly with feathers fluffed. Appetite decreases markedly, and the bird might stop eating entirely for periods. They may also show signs of general illness like lethargy and reduced responsiveness to their environment. At stage 3, you might also notice secondary complications. The pigeon might develop a fever, become dehydrated, or show signs that the infection is affecting other systems like the digestive tract or nervous system. Stage 4 is the recovery and rehabilitation phase, which is just as important as treating the active infection. Even after the acute symptoms resolve, the pigeon's respiratory system needs support to heal completely and regain full function. During recovery, residual symptoms might persist for days or weeks. There might still be occasional mild discharge, slight breathing sounds, or reduced activity level. The pigeon's immune system will be depleted and needs support to prevent reinfection or secondary infections. This is also when long-term complications can develop if the recovery isn't managed properly. Some pigeons develop chronic respiratory issues, reduced exercise tolerance, or increased susceptibility to future respiratory infections. Now let's move into prevention strategies, which are always more effective and less costly than treatment. Effective prevention involves both environmental management and proactive health support using natural methods. Environmental prevention starts with ventilation. Your pigeon loft or housing must have excellent air circulation without creating drafts. This means having air intake at one level and air exit at another level, allowing for continuous air exchange. The air should change completely several times per hour, but without creating cold drafts directly on the birds. Humidity control is crucial. Ideal humidity levels for pigeons are between 40–60%. Higher humidity promotes fungal growth and makes bacterial infections more likely. Lower humidity dries out mucous membranes and reduces their protective function. Use hygrometers to monitor humidity levels and adjust ventilation, or use dehumidifiers as needed. Temperature stability helps maintain immune function. While pigeons can adapt to various temperatures, sudden changes stress their systems. Avoid temperature swings of more than 10–15 degrees in a short period. In cold weather, provide adequate shelter and windbreak without compromising ventilation. Population density directly affects infection risk. Overcrowding increases pathogen load in the environment and creates stress. Provide adequate space, at least 2–3 cubic feet per bird in housing, with more space being better. This allows for proper social distancing and reduces competitive stress. Cleanliness protocols are essential. Remove droppings regularly, daily in warm weather, every few days in cool weather. Clean waterers and feeders regularly with hot water and natural disinfectants. Replace bedding material before it becomes soiled or moldy. Stress reduction supports immune function. Minimize handling except when necessary. Maintain consistent routines for feeding, lighting, and activities. Provide environmental enrichment like perches at different heights and hiding spots. Avoid sudden changes in housing or flock composition. Quarantine protocols prevent introduction of infections. Any new birds should be isolated for at least 2 to 3 weeks before joining the main flock. During quarantine, observe carefully for any signs of illness. Treat any quarantine area as a separate facility with different equipment and handling procedures. Now let's discuss natural preventive herbs that can significantly boost your pigeon's respiratory health when used regularly and correctly. Oregano is one of the most powerful preventive herbs for respiratory health. It contains carvacrol and thymol, compounds that have strong antibacterial, antiviral, and antifungal properties. These compounds help maintain healthy microbial balance in the respiratory tract and prevent pathogenic organisms from establishing infections. For prevention, use high-quality dried oregano. Avoid oregano that's been sitting in storage for long periods, as the active compounds degrade over time. The oregano should smell strongly aromatic and have good color. Avoid oregano that's brown or has little smell. Prepare oregano prevention water by adding 1 teaspoon of dried oregano per liter of water. Let this steep for at least 30 minutes before offering to your pigeon. The water should have a noticeable oregano scent and slightly bitter taste. Offer this oregano water once per week as a replacement for regular drinking water. Some pigeons might initially reject oregano water due to the taste. You can start with weaker concentrations, half a teaspoon per liter, and gradually increase to full strength as they become accustomed to it. You can also mix oregano water with regular water in increasing proportion. Thyme is another excellent preventive herb that works particularly well for respiratory health. Thyme contains thymol, eucalyptol, and other compounds that have expectorant properties. They help clear mucus from the respiratory tract and maintain healthy airway function. Thyme preparation requires careful attention to avoid making it too strong. Use 1 tablespoon of dried thyme leaves per cup of hot water. Steep for exactly 10 minutes. Then strain thoroughly and cool to room temperature. The resulting thyme tea should be light brown and have a pleasant herbal aroma. Offer thyme tea twice per week, replacing regular drinking water for 1 day each time. Thyme tea can be particularly beneficial during seasonal transitions, when respiratory infections are more common, such as early spring and late fall. Eucalyptus requires very careful use, but can be extremely effective for respiratory prevention. Eucalyptus contains volatile oils that have antimicrobial properties and help open airways. However, eucalyptus can be toxic in large amounts, so precise dosing is crucial. Use only eucalyptus essential oil that's specifically labeled as safe for internal use. Add exactly 2 to 3 drops per liter of water. Never exceed this amount. The water should have a very slight eucalyptus scent but shouldn't smell strongly of eucalyptus. Offer eucalyptus water only once per week and monitor your pigeons carefully for any adverse reaction. Signs that eucalyptus concentration is too strong include reduced water consumption, digestive upset, or any behavioral changes. If you notice any of these signs, discontinue eucalyptus immediately and provide fresh water. Garlic is a powerful natural antibiotic that can significantly boost immune function and help prevent respiratory infections. Garlic contains allicin, which has strong antibacterial and antiviral properties. However, garlic must be prepared correctly to activate the allicin. To prepare garlic prevention treatment, crush 1 fresh garlic clove and let it sit for 10 to 15 minutes to allow allicin formation. Then mix the crushed garlic with 1 cup of water and let it steep for 30 minutes. Strain out all garlic pieces and add the garlic water to drinking water. Use garlic water twice per week for prevention. The water should have a mild garlic scent but shouldn't smell strongly. If it smells very strong, dilute it further. Some pigeons might initially avoid garlic water, so start with weaker concentrations and gradually increase. Fresh garlic is much more effective than garlic powder or dried garlic products. The allicin in fresh garlic is more potent and bioavailable. Store fresh garlic properly and replace it regularly to maintain potency. Echinacea is an excellent immune system booster that can help prevent respiratory infections by strengthening overall immune function. Echinacea stimulates white blood cell activity and enhances the body's natural defense mechanisms. Echinacea should be used cyclically rather than continuously. Use echinacea for 1 week, then take a week off, then repeat. This cycling prevents the immune system from becoming accustomed to the stimulation and maintains effectiveness. Prepare echinacea tea using dried echinacea root or leaf. Use 1 tablespoon per cup hot water. Steep for 15 minutes, then strain and cool. Offer echinacea tea for 3 consecutive days per week during the on weeks of the cycle. Echinacea can be particularly valuable during high-stress periods like breeding season, racing season, or when environmental conditions favor respiratory infections. Now let's move into treatment protocols for active respiratory infection. Treatment approaches vary significantly depending on the stage of infection, so we'll cover specific protocols for each stage. Stage 1 treatment focuses on supporting the immune system and preventing progression while using gentle natural antimicrobial. At this stage, the infection is mild and the bird's own immune system can likely overcome it with proper support. Increase oregano water to daily use during Stage 1 treatment. Instead of once-weekly prevention, offer oregano water every day until symptoms resolve, plus 3 additional days. This provides consistent antimicrobial support without being too aggressive. The honey provides natural antibacterial properties and helps maintain energy levels during the immune response. Provide environmental support by ensuring optimal temperature, humidity, and air quality. Reduce any stress factors like loud noises, disruptions, or changes in routine. Ensure the affected bird has easy access to food and water without competition from other birds. Consider isolation if you have multiple birds. While Stage 1 infections might not be highly contagious, isolation prevents stress from social competition and allows you to monitor the individual bird more closely. Monitor progress daily and keep detailed records. Note any changes in discharge quantity or character, breathing patterns, activity levels, and appetite. If there's no improvement within 2 to 3 days or if symptoms worsen, move to Stage 2 treatment protocol. Stage 2 treatment requires more aggressive intervention with stronger herbal combinations and more intensive monitoring. At this stage, the infection has progressed and needs active treatment to prevent further deterioration. Combine oregano and thyme for enhanced antimicrobial effect. Prepare a mixture using half a teaspoon each of oregano and thyme per cup of water. This combination provides broader spectrum antimicrobial activity and helps clear respiratory secretions. Add garlic to the daily protocol. Prepare fresh garlic water daily and add it to the drinking water along with the oregano-thyme mixture. The combination of all 3 herbs provides powerful antimicrobial support. Introduce steam therapy to help clear respiratory secretions. Add 3 to 4 drops of eucalyptus oil to a bowl of hot water and allow the pigeon to breathe the steam for 5 to 10 minutes. Twice daily, ensure proper ventilation during steam therapy and never force the bird to stay in the steam. Increase environmental temperature slightly, 5 to 10 degrees above normal, to support immune function. Provide additional lighting if natural daylight is limited, as adequate light supports immune function. Consider nutritional support with vitamin C and vitamin E supplements. These antioxidants support immune function and help reduce inflammation. Crush vitamin C tablets and add small amounts to drinking water, or provide foods high in these vitamins. Monitor more frequently, at least twice daily, and keep detailed records. Stage 2 infections can progress rapidly, so close monitoring is essential. If there's no improvement within 2 to 3 days of intensive treatment, or if symptoms worsen, move to Stage 3 protocols. Stage 3 treatment represents an emergency situation requiring immediate and aggressive intervention. At this stage, natural treatments should support but not replace veterinary care if available. Implement the strongest herbal combination protocol. Combine oregano, thyme, and garlic at maximum safe concentrations. Prepare strong herbal teas and offer them as the primary drinking water. Monitor water consumption carefully to ensure adequate hydration. Increase steam therapy to 3 times daily. The steam helps clear thick secretions and provides direct antimicrobial effect to the respiratory tract. Add eucalyptus oil to each steam session, but monitor carefully for any adverse reactions. Provide intensive environmental support. Increase temperature by 10-15 degrees above normal. Provide very high quality, easily digestible foods. Ensure absolute peace and quiet to reduce stress. Consider using a hospital cage or intensive care setup if available. Add echinacea to boost immune system function. At Stage 3, the immune system needs maximum support. Prepare strong echinacea tea and add it to the drinking water, along with other herbal treatments. Consider additional supportive herbs like astragalus for immune support, marshmallow root for soothing inflamed tissues, and ginger for anti-inflammatory effects. These can be prepared as teas and added to drinking water or offered separately. Monitor continuously and be prepared for emergency veterinary intervention. Stage 3 infections can become life-threatening rapidly. If the bird shows signs of severe respiratory distress, stops eating entirely, or becomes unresponsive, immediate veterinary care may be necessary. Recovery phase treatment is crucial for preventing relapses and restoring full health. Even after acute symptoms resolve, the respiratory system needs continued support to heal completely. Continue herbal support at reduced intensity. Use oregano water every other day instead of daily. Maintain thyme tea twice weekly. Continue garlic water twice weekly. This provides ongoing antimicrobial support without overwhelming the system. Focus on immune system rebuilding. Continue echinacea cycling to help restore immune function. Add probiotics to support overall health and immune function. Provide high-quality nutrition with emphasis on protein for tissue repair. Gradually return to normal environmental conditions. Slowly reduce supplemental heat over several days. Resume normal activities gradually, watching for any signs of relapse. Avoid stress during the recovery period. Monitor for long-term complications. Some pigeons develop chronic respiratory issues or increased susceptibility to future infections. Watch for persistent mild symptoms, reduced exercise tolerance, or frequent minor respiratory problems. Let's discuss specific herb preparation methods in detail, because proper preparation is crucial for effectiveness and safety. Oregano preparation requires attention to quality and freshness. Use oregano that's been properly dried and stored away from light and moisture. The oregano should retain strong color and aroma. Brown, odorless oregano has lost its active compounds. For treatment concentrations, use 1 teaspoon of dried oregano per cup of water. Pour hot, not boiling water over the oregano and let it steep for 15 to 20 minutes. Strain thoroughly to remove all plant material. The resulting liquid should be golden brown with strong oregano aroma. Store prepared oregano water in refrigerator for no more than 48 hours. Always prepare fresh supplies every 2 days. Never leave oregano water sitting at room temperature for extended periods as it can develop harmful bacteria. Thyme preparation follows similar principles but requires different timing. Use 1 tablespoon of dried thyme leaves per cup of hot water. Steep for exactly 10 minutes. Longer steeping can extract bitter compounds that pigeons will reject. Strain thyme tea very thoroughly as small leaf particles can cause choking. The finished tea should be clear, light brown, and have pleasant herbal aroma. If the tea is very bitter or has strong astringent taste, it's too concentrated and should be diluted. Garlic preparation must activate the allicin compounds. Crush fresh garlic cloves and let them sit for 10 to 15 minutes before adding water. This allows enzymatic reactions that create the active compounds. Never use pre-minced garlic or garlic powder, as these have reduced activity. After steeping, strain garlic water through fine mesh to remove all particles. Garlic particles can cause digestive irritation and make the water unpalatable. Fresh garlic water should be prepared daily as the active compounds degrade quickly. Eucalyptus requires extreme care in preparation and use. Use only eucalyptus essential oil labeled as safe for internal use. Never use fragrance oils or industrial eucalyptus products. Measure very carefully using dropper bottles marked in drops. Add eucalyptus drops to water and mix thoroughly. The water should have barely detectable eucalyptus scent. If it smells strongly, it's too concentrated and could be toxic. Start with 1 drop per liter and increase gradually only if needed. Combination preparations require understanding of herb interaction. Oregano and thyme work synergistically and can be combined safely. Garlic can be combined with other herbs but may make the water less palatable. Eucalyptus should generally be used separately from other herbs. When combining herbs, prepare each one separately first, then mix the prepared liquid. This ensures proper extraction of active compounds from each herb and allows for better control of concentrations. Dosage guidelines are critical for both effectiveness and safety. Underdosing won't provide therapeutic benefits, while overdosing can cause adverse reactions or toxicity. For oregano, the standard prevention dose is 1 teaspoon per liter of water once weekly. Treatment doses increase to 1 teaspoon per cup of water daily. Never exceed this concentration as stronger oregano water can cause digestive irritation. Thyme dosage should not exceed 1 tablespoon per cup of water. Higher concentrations become bitter and astringent, reducing palatability and potentially causing digestive upset. For very sensitive birds, start with half this concentration. Garlic dosage should not exceed 1 crushed clove per cup of water. Larger amounts can cause digestive irritation and may make water completely unpalatable. Some birds are particularly sensitive to garlic and may require lower concentration. Eucalyptus dosage is critical due to toxicity potential. Never exceed 3 drops per liter of water. Start with 1 drop per liter and increase only if necessary. And if birds show no adverse reactions, discontinue immediately if birds reduce water consumption or show any behavioral change. Feeding schedules affect herb effectiveness. Morning administration is generally most effective as bird systems are most receptive after fasting overnight. Provide herbal water as the first water source of the day when possible. Replace herbal water with fresh preparation every 24 hours. Never leave herbal preparations sitting for multiple days as they can develop harmful bacteria or lose potency. Clean water containers thoroughly between herb doses. For treatment protocols, consistency is crucial. Provide herbal treatments at the same times each day. Maintain treatment schedules even if symptoms seem to improve. Stopping too early can allow infections to return stronger. Monitor water consumption carefully during herbal treatment. Birds must maintain adequate hydration for herbs to be effective, and if water consumption decreases significantly, dilute herbal preparations or provide additional plain water sources. Quality control and sourcing of herbs significantly affects treatment outcome. Poor quality herbs may lack active compounds or contain contaminants that reduce effectiveness or cause problems. Purchase herbs from reputable suppliers who can provide information about harvest dates, storage conditions, and testing for contaminants. Avoid herbs that have been stored for long periods or in poor conditions. Store herbs properly to maintain potency. Keep dried herbs in airtight containers away from light heat and moisture. Replace herbs that lose color, aroma, or develop musty odor. Most dried herbs maintain potency for 1 to 2 years when stored properly. For essential oils like eucalyptus, purchase only from suppliers specializing in therapeutic-grade oils. Check expiration dates and storage recommendations. Store essential oils in dark glass containers away from heat and light. Consider organic sources when possible to avoid pesticide residues. This is particularly important for herbs like oregano and thyme that are commonly treated with pesticides in commercial agriculture. Safety considerations and contraindications are important aspects of herbal treatment that must be understood to avoid problems. Some birds may be particularly sensitive to certain herbs. Start with reduced concentrations for birds that haven't been exposed to herbal treatments before. Monitor carefully for any adverse reactions during the first few days of treatment. Signs of herb sensitivity include reduced water consumption, digestive upset, changes in droppings, behavioral changes, or any worsening of symptoms. If any of these occur, discontinue the problematic herb immediately. Pregnant or breeding birds may require modified herbal protocols. Some herbs can affect reproductive function or be harmful during egg laying. Consult specialized resources for breeding bird modification. Very young birds may be more sensitive to herbs and require reduced concentrations. Birds under 6 weeks old should generally receive only very mild herbal treatments, if any. Birds with liver or kidney problems may not process herbs normally and could experience toxicity at normal dose. These birds require careful monitoring and possibly reduced herb concentrations. Drug interactions are possible with some herbs. Garlic can increase bleeding risk in birds taking blood-thinning medications. Some herbs may interfere with antibiotic absorption. If birds are receiving veterinary medications, consult with a veterinarian about herb interactions. Emergency situations and when to seek veterinary help are important considerations in natural treatment protocols. Immediate veterinary attention is needed if birds show severe respiratory distress with open-mouth breathing, stop eating completely for more than 24 hours, become unresponsive or listless, show signs of severe dehydration, or if symptoms worsen rapidly despite treatment. Natural treatments can support but should not delay appropriate veterinary care in serious situations. The goal is to provide the best possible outcome for the bird, which sometimes requires combining natural and conventional treatment. Prepare for emergencies by having contact information for avian veterinarians, maintaining basic first aid supplies, and knowing how to provide supportive care while arranging veterinary treatment. Document treatment protocols and outcomes carefully. Keep records of which herbs were used at what concentrations for how long and what the outcomes were. This information helps improve future treatment protocols and can be valuable information for veterinarians if needed. Case studies can help illustrate practical application of these treatment protocols in real-world situations. Case study 1 involved a racing pigeon showing early stage 1 respiratory symptoms during training season. The bird showed minimal clear nasal discharge and slight reduction in activity. Treatment began immediately with daily oregano water and honey supplementation. Environmental temperature was increased slightly and stress was minimized. Symptoms resolved completely within 5 days with no progression to more serious stages. The bird returned to full racing form and completed the season successfully. Case study 2 involved a breeding pair where both birds developed stage 2 respiratory symptoms with obvious nasal discharge and mild breathing sounds. Treatment included combined oregano-thyme water, daily garlic supplementation, and twice-daily steam therapy. Environmental improvements included better ventilation and humidity control. Both birds recovered within 8 days, though treatment was continued for an additional week to ensure complete recovery. Case study 3 was a more serious stage 3 case involving a show pigeon with severe respiratory distress, thick discharge, and open mouth breathing. This bird required aggressive herbal treatment combined with veterinary antibiotic therapy. The herbal protocol included maximum strength oregano thyme garlic combinations, 3 times daily steam therapy, and immune support with echinacea. Long-term management strategies are important for birds that have experienced respiratory infections, as they may be more susceptible to future problems. Maintain enhanced prevention protocols for birds with respiratory infection history. Continue weekly oregano water indefinitely. Provide monthly echinacea cycling to support immune function. Monitor these birds more carefully during high-risk periods like seasonal changes or breeding season. Environmental improvements become even more important for previously affected birds. Ensure optimal ventilation, humidity control, and cleanliness. Minimize stress and maintain stable conditions as much as possible. Regular health monitoring helps catch any recurring problems early. Weekly health checks should include examination of nasal passages, eyes, and breathing patterns. Keep records of these examinations to track any trends or recurring issues. Seasonal adjustments may be necessary for birds with respiratory infection history. These birds might need additional support during weather changes, humidity fluctuations, or other environmental stresses that could trigger respiratory problems. In conclusion, respiratory infections in pigeons are serious but manageable health issues when approached with knowledge, preparation, and appropriate treatment protocol. Natural herbal treatments can be highly effective, particularly when combined with excellent environmental management and early intervention. The key principles for success include early recognition of symptoms, immediate and appropriate intervention, consistent application of treatment protocols, careful monitoring of progress, and understanding when additional veterinary support might be needed. Prevention remains the most effective approach, and the natural prevention protocols we've discussed can significantly reduce the risk of respiratory infections in your pigeon. When infections do occur, the staged treatment approach provides a systematic method for addressing problems at the appropriate intensity level. Remember that every bird is an individual, and treatment protocols may need to be adjusted based on the specific bird's response, sensitivity, and overall health status. Start conservatively, monitor carefully, and adjust as needed based on the bird's response. If this comprehensive guide to pigeon respiratory infections has been helpful for understanding these important health issues, please hit that like button and share your experiences in the comments. Have you dealt with respiratory infections in your birds? What natural methods have you tried? Your experiences help other pigeon keepers learn and improve their birds' health. Don't forget to subscribe and ring that notification bell, because we have more comprehensive health guides coming that cover all aspects of pigeon health using natural methods. Whether you're dealing with digestive issues, parasites, or other health challenges, there's always more to learn about keeping your pigeons healthy naturally. I love reading your comments and questions about natural pigeon health care. Your engagement helps build a community of pigeon keepers who understand that effective healthcare combines the best of natural methods with good observation, environmental management, and appropriate veterinary support when needed. Until next time, remember that respiratory health is fundamental to overall pigeon health, and the natural methods we've discussed today can help you maintain healthy, vigorous birds that can resist infection and recover quickly when problems do occur. Keep your birds healthy naturally.